Have you ever wondered about the effectiveness of acupuncture in treating chronic pain? It's a question that sparked controversy in the medical world for years. Acupuncture, a treatment that involves inserting thin needles into specific points on the body, is widely used in clinical practice. Yet, its efficacy for chronic pain conditions like nonspecific musculoskeletal pain, osteoarthritis, chronic headaches, and shoulder pain is still under debate. So what does the latest research say? Let's delve into the latest research findings to get a clearer picture. The researchers' objective was to update an individual patient data meta-analysis to determine the effect size of acupuncture for 4 chronic pain conditions. To do this, they delved into the treasure troves of medical research databases, Medline and the Cochrane Central Registry of Controlled Trials. Their search was exhaustive, covering randomized trials published up until the last day of December 2015. They were selective. The trials they included were those of acupuncture needling versus either sham acupuncture or no acupuncture control. These trials pertain to nonspecific musculoskeletal pain, osteoarthritis, chronic headache, or shoulder pain. But they didn't just take any trial. They made sure that allocation concealment was unambiguously determined to be adequate. Then came the raw data collection process. The nitty-gritty details were obtained from the study authors themselves and entered into their individual patient data meta-analysis. Their main outcome measures: pain and function. With data received for a total of 20,827 patients from 39 trials, the results were quite enlightening. The results showed that acupuncture was superior to sham, as well as no acupuncture control for each pain condition. This was the conclusion drawn from an extensive meta-analysis of randomized trials involving over 20,000 patients suffering from chronic pain conditions, be it nonspecific musculoskeletal pain, osteoarthritis, chronic headache, or shoulder pain. Acupuncture showed its prowess by displaying significant effects compared to both no treatment and sham treatment. The differences between groups were close to half a standard deviation compared with no acupuncture control and close to a fifth standard deviation compared to sham treatment. What's fascinating is the persistence of acupuncture effects over time. The study demonstrated that acupuncture's treatment effects do not just vanish into thin air. There is only a minor decrease, approximately 15%, in the treatment effect at the end of a year. Interestingly, the variations in the effect size of acupuncture in different trials were found to be driven predominantly by differences in treatments received by the control group, rather than by differences in the characteristics of acupuncture treatment. In conclusion, acupuncture is effective for the treatment of chronic musculoskeletal headache and osteoarthritis pain. Treatment effects of acupuncture persist over time and cannot be explained solely in terms of placebo effects. Referral for a course of acupuncture treatment is a reasonable option for a patient with chronic pain.